One of the things that we do at Austin-Weston is we do a lot of mommy makeovers. Mommy makeovers involve doing breasts and tummies at the same time, but there are a lot of different options with breasts and tummies. And so what we're going to do here when we're talking about mommy makeovers is we're going to go through all the options and make sure you understand what we do and why we do it. Mommy makeover is a lay term, I guess, that was made up for the type of surgeries that are most common after mothers have had all their babies and they want to get their bodies back. And as you know, pregnancy is difficult on breasts and tummies. And so most commonly when moms come in, that's the combination that we do, is we look at their bodies, and depending on what they want to do, and of course depending on their particular anatomy, we can combine both breast surgery and abdomen surgery at the same time. And so there are options like breast augmentations, or even breast reductions, or breast lifts. And you can also sometimes combine those surgeries, like you can do a breast augmentation and a lift at the same time. And when we do a breast reduction, generally it's always done with a lift at the same time. And then when you combine that with the abdomen, you either combine it with liposuction. Sometimes women don't need tummy tucks after having babies. And in fact, I had a patient yesterday who is 48 years old and has had 3 children and looked so good that she didn't need a tummy tuck, and that's remarkable. And so what we did was we did liposuction and a breast lift. Most commonly though, after pregnancy, the tissues get loose, like the muscles stretch out and the skin gets a little loose, and maybe you've gained a few pounds and you're a little bit thicker, and so we most commonly do tummy tucks in our mommy makeovers. A tummy tuck is like a lift. The incision is down low from generally the hip bone to hip bone area. We loosen it up and we sculpt it with liposuction. We pull it down like a window shade and make it nice and tight. The tummy tuck treats all 3 things of the abdomen. There's loose muscle that gets tightened with a suture that tightens the muscles back up. The skin gets tightened by loosening it and pulling it down, and then the fat gets sculpted with liposuction. In liposuction, all you do is sculpt the fat, but you have to have tight enough muscles and tight enough skin to allow that. If you have loose muscle or loose skin, it's not the proper operation. Now, there are different types of tummy tucks, and so some women have, their muscles are okay and they only have a little bit of loose skin like below the belly button. Well, that's perfect for what I would call a mini or a modified tummy tuck. With an incision down low, you just loosen it up and tighten the skin. You might not even have to tighten muscle. And so there are different types of tummy tucks. There's a full classic tummy tuck where the muscle is tightened and the fat is sculpted and the skin is also tightened, down to a mini tummy tuck where it's just a little bit of skin at the bottom. I would think that the most common thing that we see with a mommy makeover is a tummy tuck and a breast augmentation or breast lift. That's the most common one. There are very few women that after having their children can get away with just liposuction, because if there's some looseness, then you usually want to tighten that. Now, there's an occasional woman that comes in and says, I don't care what I look like naked, I want to look good in clothes. And so maybe liposuction is appropriate there, but liposuction is not going to make you tight. And so there's what you look like with your clothes on, and there's what you look like without your clothes on. And so you have to decide which of those views is important to you. For mommy makeovers, generally we can do everything at once. On occasion, I will see a patient that wants both a breast augmentation and a breast lift. If they are so droopy sometimes I think that it's better done in stages. For instance, when you put an implant in, then it can be difficult to get the breast tissue over the implant and have it stay there and have it be beautiful. And in an occasional patient, I will do the breast lift first and then come back after it's healed and do the breast augmentation. Most commonly, we do combinations of tummy tucks and breast, and sometimes we do thigh suction at the same time, for instance. But we really don't do combinations of, say, a thigh lift and a tummy tuck. Those we have to stage. And so there's different reasons why we would stage them, you know, depending on like where the incision is. The thigh lift incision is close to the tummy tuck incision, and so we don't want to combine those. Huge benefit to doing everything at one time. And we do a lot of combination surgeries here. We have an unusual practice in that we have 4 plastic surgeons operating in the same operative theater, if you will, at one time, and we can also sometimes do 2 surgeons. And so it makes it quicker, it makes it less expensive, it shortens your recovery period. So we use 1 anesthesia, 1 operation, 1 recovery period, and half as expensive on the 2nd and 3rd procedures. And so sometimes we combine, you know, arm lift and breast lift and tummy tuck and lots of things. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.